It is the two-day biannual conference of the West African Health Sector Union Network, WAHSUN, with the theme, the COVID-19 pandemic, lessons for the future. Labor leaders underscore the importance of investing in public health.
Let me reiterate the fact that, and this has been propounded globally, that the difference between life and death during the pandemic is actually public health services. In many countries around the world, and we can count many of them, private health services, which all of us know are for profit, they have not been able to actually respond effectively as the public health services. We have a lot of campaigns, particularly that the challenge of COVID-19, as I said, have exposed the inefficiencies in our system. One is the dearth of technology in the health sector, particularly in the continent of Africa. Because what drives healthcare delivery and bring about quality globally now is technology, medicine, and human resource for health. Spend money to have the latest technology for us to have accurate diagnosis, and this is a campaign that we must actually lead. It's not just the structure, to have a hospital and call it a structure. Any hospital that is only a structure without the technology is a caricature.
The emphasis here is the need for the African sub-region to develop the capacity to produce vaccines and reduce dependence on foreign countries. Speaking to newsmen on the sidelines of the conference, Sani Baba Mohammed, PSI Regional Secretary for West Africa and Arab countries, acknowledged that African leaders failed in their responsibility of providing adequate personal protective equipment for healthcare workers.
A situation where health workers are operating in various hospitals without having the protective gears. So this is a campaign that has been ongoing, and you can imagine what somebody shared with us here. When governments like Nigeria are spending about 4 trillion on subsidies, and yet you go to hospitals, you don't find facilities, and there are no equipment. So really it's unfortunate, and I can tell you African leaders and head of states have not done well. They have not done well. I can't give them any pass mark for that, because we're still fighting for such PPEs to be provided, and they have not done much. We are not putting enough resources, like you know. The Abuja Declaration really made it compulsory for every country to dedicate 15% of their annual budget to health, but many of them have not even gone beyond 9%. So I can tell you they are not doing very much. I mean, they're not doing very well.
Underscoring the significance of the conference, WAHSUN's chairperson, Perpetua Ofori Ampofo, said the conference is significant because it avails health sector unions the opportunity to discuss the lessons learned from the COVID-19 pandemic and better strategize for the future.
He said we've chosen to be here, not only because we've been promised some allowance or something, but we think that, of course, these patients need our care. And despite the fact that we did not understand how the virus was going to operate, people were out there. Dr. Gilbert will tell us their experiences in Togo. Everybody was out there, and I'm sure our comrades here, you also have your own stories to share from Nigeria. We were there and working. But the only thing our governments can do for us to appreciate what we have gone through in this pandemic, in terms of losing some of our comrades and taking infections to our homes and having our family members and friends die, the best they can do for us is to invest heavily in health so that we can have better environments to practice. We can stop or curtail the current movement of our comrades to go out there and practice elsewhere because conditions of service are not good.
The two-day conference is expected to provide a communique that will chart a course of action for better service delivery in the sub-region. From Abuja, Michael Ongel reporting for Nigeria News House.